Hey guys, my name is Dr. Natalie Lopez. I'm a chiropractor practicing out of Toronto. This is my old man pup, Raji. He's going to come in and out of the phone because it's his mat, as I said. So today we're going to talk about jaw, and more specifically a little bit more on the anatomy and things that can happen that can cause some pain. So when I say things that can happen, I mean sometimes with jaw you can get a little bit more overuse injuries for those muscles working a little harder, disc injuries, or just in general joint. So to understand that, I want to give you a bit of a brief overview on the anatomy and how that can happen. So starting off with the main muscles, temporalis is this muscle that attaches on through this temple bone and into your jaw. So if you're not sure where your jaw is, if you kind of feel right in front of your ear, there's going to feel like a bony area. And you're not sure, just feel below and you'll feel kind of soft, and that's muscle. And you'll feel above, it's a little bit softer. Just right in through there is bony. So that's more where your temporalis attaches. So the reason I'm starting to talk about your temporalis is a kind of a big player for headaches, jaw pain. This one is pretty important for opening, like helping to close your mouth. And then the other muscle I want to talk about is your masseter. So your masseter is this big bulky muscle attached to your jawbone over here. So that's going to be just below where we felt that jaw joint is really called your TMJ. Just below that TMJ, just down in through here. So it'll feel like a tight band. You'll kind of feel sinking. If you're not sure, you can go forward and you'll kind of feel like almost like you're going to hit your teeth. So that's more in through that side. So that's your masseter, which really helps with closing your mouth too. So these are big ones for clenching. They tend to be the biggest players for jaw pain too. There's most research behind them for any sort of muscular pain related to jaw pain. So we're going to talk about other ones that are quite important, but they're harder to visualize. These guys are a lot, you can feel them, you can kind of sort of visualize them from what I'm saying here. The other ones are a bit harder to visualize, so kind of just bear with me. If you need any more like in-depth detailed anatomy, I would totally look into some videos that show the actual anatomy pictures on the skull. But for, just for understanding, I hope this gives you a brief overview. So the other muscles are called your pterygoids. So those are medial and lateral. We'll start with the medial pterygoid just because it's the most similar to your masseter. So your masseter attached on the outside of your jaw, and it was a big, thick, dense muscle here. Your medial pterygoid actually attaches on the inside and then in towards that jaw joint. So it's just going in through towards that jawbone up inside. So if you can kind of see just in through here, that's the main area. That's important because it also helps with closing the mouth as well. And if you think about how it makes sense, that masseter muscle helps close the mouth. So if it's the opposite but inside, that's going to be similar to it too. It has other functions, but we'll talk about that. Your lateral pterygoid, so that's a muscle that attaches inside through here. So you can kind of see this little window between your jaw, and that's a better visual for it because it's a bit deeper inside here. So you're not going to really get a true visual from this YouTube video on it, but if we can kind of understand it a little bit more. So for your lateral pterygoid, it's got two heads, and it actually attaches one of them into the disc as well as like a little bit into the joint, so that's why it's important in through here. So that muscle actually helps open the mouth. So with mouth opening, we've got our lateral pterygoid as well as these muscles just below our chin kind of here that go into, they're called your suprahyoid because your hyoid bone is just about here. You can kind of feel it, a little bony prominence. Don't be aggressive or anything, but these muscles and your lateral pterygoid help open up your mouth versus your other muscles, which was your temporalis, your masseter, and your medial pterygoid. They help close your mouth just on the position that they are. They're just going to pull up versus your lateral pterygoid, the way it is, it's going to help open up that mouth. This guy's a little bit stiff because, he's a skeleton, but hopefully that gives you a little more understanding. Alright, so we're going to talk about a few other movements that the jaw is involved in. So one of those is protrusion. So that's sticking your jaw out and coming back. So protrusion actually involves the lateral pterygoid and a little bit of that medial pterygoid. So that's more so these internal muscles because the way they are positioned as they kind of contract, they'll help bring your jaw forward. Versus like the masseter temporalis, they don't really have that position inside the jaw on a bit of an angle to allow that movement. And then the other one we want to think about is protrusion. So that's bringing the jaw back. So it's very small movement. So it's more, I always like to think of it, if I jump my jaw forward, how do I bring it back? So that's going to be your digastric muscle. So your digastric muscle, again, attaches from under the chin to the behind the ear. So its position is going to help retract it back. And so that's what I like to think about. This digastric muscle has two different parts to it, a posterior part and an anterior part. They both function the same in the sense that they're going to be pulling back. That's the main one for protrusion. A little bit is done by your temporalis, just some of the posterior fibers can help retract that jaw and bring it back. And then another common movement is going side to side for the jaw. And these guys are actually done by the pterygoids because the way they're positioned, as one contracts, so if I'm contracting my left side, that's going to be the inside of my mouth, those pterygoid muscles, I'm going to be jutting my jaw towards the right. So as the opposite contracts, it pushes it the other way. So those are the main ones for that. And then these other guys just kind of stabilize the jaw. So those are the main players for jaw movements and just overall function. So we already kind of talked about there's a few muscles that have to work together to create those movements. So when there's more tension in one area versus the other, it can actually put a little bit more pressure into that joint, or sometimes even like if that lateral pterygoid is a little bit tighter or has been overworking, it can actually put a bit more pressure, like a bit more of effect on the disc. So the disc is just between the jaw and the joint, and through here, you can't really see it on this guy, but just imagine this part is kind of like a little small disc that helps with movement. So because that lateral pterygoid is attached to it, sometimes it can kind of over pull it or other aspects like that, and you can actually get the disc kind of move a little bit away from where you want it between the joints. So with that, the reason it's important is because when you're opening your mouth, you're actually using two different joints, but they have to do the same action. So you're opening your mouth, and that left and right side, they have to work together more symmetrically. Unfortunately, we're human and we're allowed to have differences, so sometimes you might have one side that's slightly bigger or slightly different size of the joint, but you still want it to work together. With that, can kind of lead to like some joint issues or disc. So when I say disc issues, if you open your mouth and you find you're clicking or shifting your jaw, sometimes that can be disc related. Usually it's when you're halfway opening, and the reason for that is because with opening your mouth specifically, it's actually an interesting motion that you have a rolling effect first in the first few millimeters, and then you translate forward, so you actually glide forward. And you can see, probably might have heard or seen, that's my jaw. I have disc issue on my right side, but as you're opening, the first few is you're rotating in that joint, and then the last bit is you're sliding forward. So rotating through there and then sliding forward to get that mouth opening. Hopefully that's a little bit more clear of an understanding. So if you have a disc issue, that disc sometimes travels a little bit more forward typically, and then it gets kind of a little caught, so that's where you have the clicking of it moving back. But you can also have muscular tension that can be kind of like a snapping sensation around the joint. So always see your healthcare professional, because they're going to be able to appropriately determine what's going on with your case. So this is just kind of to give you an overview if you're kind of unsure of what's going on, or even if you have any jaw pain, that could be something to look into, especially if you have headaches. That might be something that could be related to your headaches. A lot of times the back of the neck, it tends, especially the upper back of the neck, it's the stabilizer for your jaw. You really can't open your mouth without stabilizing your head, or else your jaw would just fall forward. So they're often related. So if you have headaches, this might be an area to take a look at with a practitioner. But yeah, if you have any questions, or just want to give me any feedback on the comments, please hit like or subscribe, and I'll catch you in the next one. Bye!